Hi everyone. Let's talk about diabetic emergencies, the important concepts, and we'll do some practice questions. We often call it diabetes, but it's actually diabetes mellitus. And that's important because there's another disease called diabetes insipidus, which is a completely different disease. So what's the problem with diabetes? Well, the basic problem is that sugar, which is needed by all the cells, cannot enter the cells. So the things that we need to review is that cells need sugar, and we get sugar from carbohydrates, juice, bread, pasta. And then carbohydrates are broken down into simple sugars called glucose. The problem is glucose can't enter the cells without a hormone called insulin that's made in the pancreas. The only organ that can use glucose without insulin is the brain. The pancreas makes the insulin to help the glucose enter the cells. There are two different types of diabetes. There's type 1 and type 2. Type 1 is called juvenile onset diabetes. Usually children are diagnosed around 2 years old, 2 to 3 years old. And then it's also called insulin dependent diabetes. And in this situation, type 1, the pancreas doesn't make insulin. Diabetes type 1 is actually an autoimmune problem, and by the time the child hits 2 years old or so, parts of the pancreas called the islets of Langerhans actually become destroyed, and then those islets are the cells that actually make the insulin, so then the child no longer makes insulin and has to get insulin injections. In type 2 diabetes, it's called adult onset diabetes, or non-insulin dependent diabetes. The cells become resistant to the insulin. So the pancreas is there, the pancreas is making insulin, but over time the cells become resistant to the insulin and won't allow the glucose to pass into the cells. It's usually from years and years of eating lots and lots of sugar. The person with type 1 diabetes requires daily insulin injections, or now there's a newer insulin pump. And they usually require long-acting and short-acting insulin. And it's usually kept in the refrigerator, so if you arrive on scene and you're looking for medications, insulin will be found in the refrigerator. The newer systems are kind of cool. They use an insulin pump in which an electrode with a small needle is attached to either the arm or the abdomen. And then there's a tube that's connected to a little computer in which the patient can actually type in how much insulin to be injected in. It's better than having to give injections constantly. Type 2 diabetes, the one in which the cells become resistant to insulin, usually can be controlled with diet, a low carbohydrate diet, and also with oral medications to help the cells become more efficient at absorbing the insulin that is still made from the pancreas. Before we begin talking about signs and symptoms and treatment, we need to know a little bit about normal blood glucose levels and fasting blood glucose levels. So normal blood glucose level in a person, which depends upon their eating and how far it's been since they've eaten, is anywhere between 60 and 140. And you can use a small glucometer and a small little skin prick, and it'll tell you what the glucose level is. Now, a fasting blood glucose level, which means you haven't had any food in the previous 12 hours, is anywhere between 60 and 100 for normal. And if it shows between 100 and 125 fasting, then that's usually considered pre-diabetes. And if it's greater than 125, that's usually a good sign that it's diabetes. Regardless of whether it's type 1 or type 2 diabetes, the signs and symptoms are basically the same and broken down into two parts. Either the blood sugar is too high or the blood sugar is too low. So let's look at hypoglycemia, low blood sugar. Usually occurs when the patient has taken his insulin but has not eaten. The onset is sudden. The patient becomes confused because the brain is sensitive to low glucose. So you may have a patient in a meeting suddenly becoming combative and confused. The skin is cold and wet, and if you do a blood glucose level, it's usually below 30. It can be like 10, 20, 30. With hyperglycemia, or high blood sugar, the patient usually has eaten but didn't take their medications. This is a much slower onset. Over days, the patient just becomes more tired, has no energy. Eventually, he can go unconscious. And usually you see the 3 Ps. Polyphagia, he's eating a lot. Polyuria, he's peeing a lot. And polydipsia, he's thirsty a lot, is drinking a lot. Let's talk about the 3 Ps. So polyphagia, you're eating a lot. Well, why are you eating a lot? Well, as you eat, the blood sugar goes up, but it can't make it into the cells. So while the blood has a lot of sugar in it, the cells do not. And so the brain is trying to get more sugar into the cells, so it's causing you to be hungry. Now, why do you have polyuria? Why do you pee a lot? Well, the body is attempting to get rid of all of that high amounts of sugar that's in the blood, and what it does is it actually causes you to pee it out. Well, you can't pee out solid sugar, so when you pee out the sugar, you're peeing out water and the sugar, so you become dehydrated. And if you're dehydrated, well, then you become thirsty, and so you're drinking a lot. So what usually happens in a young child that's 2 or 3, the mom or dad takes the child into the doctor saying the child is constantly hungry, constantly peeing, and constantly thirsty. And that's going to trigger the doctor to do a test for diabetes. In addition to the 3 Ps and the slow onset over days, patients with hyperglycemia also have warm, dry skin. We already know that they're dehydrated. And if you check their blood glucose level, it's anywhere between 200 and 600 plus. Sometimes the machine, the glucometer, can't even register how high the blood sugar is. Sometimes when you have a patient with hyperglycemia, high blood sugar levels, especially in type 1 diabetes, you can smell a fruity odor on their breath. And you also notice that they have deep respirations. They're called Kussmaul respirations. And this is a sign of diabetic ketoacidosis, which is a process that occurs when the body of a patient with type 1 diabetes begins to burn fat instead of sugar. It doesn't change how you treat the patient. It's just interesting to know that this particular patient's in diabetic ketoacidosis, and it's often just called DKA. Let's talk about the treatment for hypoglycemia and hyperglycemia. So for hypoglycemia, so you're going to have that confused patient. So if the patient is confused and the patient has a blood sugar level less than 60, then you can give them a drink sweetened with sugar, sort of like juice, apple juice, orange juice. You can take a spoonful of sugar and mix it into it. You cannot give them diet soda because diet soda doesn't have sugar in it. Now, if you don't have access to any kind of an apple or orange juice, you can give them oral glucose or buccal. You can place it against their cheek. But you can never give anything orally if the patient's unconscious. So you stay with the patient until they're alert and oriented. Sometimes they'll go to the hospital, but many times they don't want to go once they're back alert and oriented. But if they are refusing transport, you have to make sure that there's a family member there to give them a meal and take care of them. The treatment for hyperglycemia is to monitor the vitals, transport the patient, and make sure they're in a position to protect their airway. Because there really isn't anything you can do on a basic life support truck that's going to treat hyperglycemia. Treatment really involves the administration of insulin, which we're not doing pre-hospital, and intravenous fluids for rehydration, which is not done on a basic life support truck, but could be done on an ALS truck. Let's try a couple of practice questions. So stop the video, read the question, figure out the answer, and then play the video. So you have an unconscious patient with a blood glucose level of 30, and your patient is on his side, airway is protected. What do you do next? Well, you can't administer oral glucose because the patient's unconscious. You can't administer insulin or help him administer his own insulin because that's not in the scope of practice for you. So the correct answer is to transport them to the hospital. Let's try one more question. So stop the video, read the question and the answer choices, and then play it again when you're ready. Your patient's been feeling weak and tired for days. His skin is warm and dry, and you notice deep respirations and a fruity odor on his breath. You suspect. Well, answer A is incorrect because hypoglycemia comes on quickly and the skin is wet and cold, and you would not notice deep respirations and a fruity odor. Now, it could be hyperglycemia without diabetic ketoacidosis, except the fruity odor and the deep respirations indicate that it is hyperglycemia with diabetic ketoacidosis. Now, do you have to be able to differentiate between hyperglycemia without and hyperglycemia with diabetic ketoacidosis? No, because the treatment is going to be the same. Protect the airway and transport them to the hospital. As always, remember to read the questions slowly and carefully. Disregard the distractors. Answer the question that's asked. Study hard and do well.